Hello, my name is Courtney Moore. I am a registered nurse who works in the Women's Center at Princeton Community Hospital as a labor and delivery nurse. I am also a student at Bluefield State College in the RN to BSN program. For our senior practicum class, we were instructed to select a topic that was important to us and could serve as a topic of change within our unit. Therefore, I chose to create my change project on postpartum hypertension. The goal of my project was to decrease the number of adverse outcomes related to postpartum hypertension by providing education to all patients at risk. The objective of my project was to create a one-page education handout that will be provided and taught to patients at discharge in the Women's Center at Princeton Community Hospital that are at high risk for postpartum hypertension following vaginal or cesarean delivery. Postpartum hypertension occurs in approximately 6 to 10% of all pregnancies and can result in maternal or fetal harm. Mothers who develop pregnancy-induced hypertension, preeclampsia, or eclampsia are at a 70% increased risk for cardiovascular mortality and type 2 diabetes, and a 30% increase for hypercholesterolemia. According to delivery records within the Women's Center at Princeton Community Hospital, there was an increase from 9.3%, which is 43 out of 460 deliveries in 2019, to 9.6%, which is 81 out of 840 deliveries in 2020. This provided supporting evidence that pregnancy-induced hypertension, preeclampsia, and eclampsia is an ongoing problem and continues to be on the rise. Therefore, the problem was identified for my change project as a lack of patient education regarding postpartum hypertension. Restraining forces for my project included time to research and create an education handout while also managing other classes I was enrolled in. It also included possible lack of support from nursing staff because a new handout that would have to be taught and given out, and the inability to keep the education handout in an easily accessible location and making sure that copies continue to be made and given out to patients. Driving forces that supported my project included the need to decrease maternal and fetal outcomes for all patients who presented to the Women's Center with pregnancy-induced hypertension, preeclampsia, or eclampsia, and preventing adverse outcomes during the postpartum period. There was also a request from some coworkers that an education handout be created for patients at risk for postpartum hypertension. For my change project, I chose to make the change within the Women's Center at Princeton Community Hospital because it is where I am currently employed. It provided an easy access to develop the change. Our unit serves 5 counties within West Virginia and 2 counties within Virginia, due to the lack of hospitals who have labor and delivery units within the immediate area. Our unit has 8 private labor and delivery suites where patients stay during and after labor. It also has 4 semi-private rooms that serve cesarean deliveries during the preoperative, recovery, and postpartum periods. We perform all cesarean sections in our private cesarean section suite. There is also an outpatient testing room where fetal non-stress tests and vaccinations such as the Tdap and RhoGAM are provided. The triage room is designated for those who come for possible complications, and they are assessed for any problems. The unit also houses a nursery that supports well babies, which are considered to be level 1 infants. It also has a level 2 nursery, which supports babies who require additional support such as intravenous therapy, oxygen therapy via oxyhood nasal cannula or CPAP, or infants that may be experiencing neonatal abstinence syndrome. In 2020, our unit had 840 deliveries. On this slide, there are pictures of our unit. The top and bottom left photos are of the level 1 and level 2 nursery. The top middle photo is of our private cesarean suite, and the top and bottom right photos are of one of our private labor and delivery suites. After deciding on a topic for my change project, a needs assessment was created and distributed to 11 staff members. The needs assessment encouraged staff to answer yes or no to the following topics. Do postpartum patients receive adequate education on postpartum hypertension? To which I received 11 no responses. Would a one-page handout be helpful to educate postpartum patients about postpartum hypertension? To which I received 11 yes responses. And would you be willing to serve on a committee to create and review the handout? To which 4 coworkers agreed to serve on a committee to help design the handout that would be provided to patients. On this slide, I included a photo of my committee members, even though we are missing one of our committee members in this photo. These ladies were excellent and provided wonderful input in developing the postpartum hypertension education handout, designating a space to keep it, and assisting with the creation of a flyer for my in-service to educate staff on our new handout. My action plan for my change project involved designing a one-page education handout that will be provided and taught to patients at discharge in the Women's Center that are at high risk for postpartum hypertension. The handout first provides a definition of postpartum hypertension, which is when blood pressure is elevated and persists after childbirth. Next, risk factors for postpartum hypertension are discussed. These include having high blood pressure during your most recent pregnancy, obesity, having multiples such as twins or triplets, chronic high blood pressure, and diabetes. Next, the signs and symptoms of postpartum hypertension are presented and include high blood pressure, which is 140/90 or greater, severe headaches that do not get better even after taking medication, changes in vision including temporary loss of vision, blurred vision, or light sensitivity, upper abdominal pain commonly under the ribs on the right side, decreased urination, and protein in the urine, which is diagnosed by a physician. The handout then instructs all patients to call their healthcare provider or go to the nearest emergency room if they have any of those symptoms. Finally, the handout reviews prevention and management of postpartum hypertension. Patients should monitor blood pressures at home at the same time every morning and evening. They should keep a log of their results, and if there are too high results, they should call their healthcare provider. Patients should also be instructed to go to their follow-up appointments, take their hypertension medication if it is prescribed by their physician, and eat a well-balanced diet including fruits and vegetables, reduction in sodium intake, and drink at least 8 glasses of water per day. It was decided during our committee meeting that the handout will be placed in a designated folder in a drawer at the nurses' station that also keeps other information handouts. One of my committee members volunteered to make sure that copies continue to be made. To the left of this slide is an example of my postpartum hypertension handout that was created. On April 1st, an in-service was held during the changing of shifts. The in-service discussed the goal and objective of the change project. A copy of the education handout was given to each staff member who attended the in-service. All parts of the handout were reviewed. The handout was then implemented following the in-service and was well received by staff. The handout was placed in an easily accessible folder in the education handout drawer. As of now, many handouts have been given out, and I am continuing to remind staff to give the handout to patients at risk for postpartum hypertension, and I have continued to talk with the designated charge nurses because they are often in charge of discharging triage patients who can be seen for blood pressure problems, as well as discharging postpartum patients who should be educated on adverse outcomes. It was hard to coordinate schedules with all committee members, but we were able to arrange dates that worked for all of us. Overall, staff has been very excited and supportive of the education handout, and thankfully I had a wonderful committee members who provided their honest input and constructive feedback so that a handout could be designed and created to address all issues relevant to patients at risk for postpartum hypertension. I am so excited that I have completed and implemented my change project within my unit. I am so happy that I have received a lot of support from staff as well. I'm glad to be a part of Planned Change thanks to my senior practicum class in the RN to BSN program at Bluefield State College. I cannot wait to continue to watch the difference that my handout makes in the weeks and months to come from education that will be provided by Women's Center staff. I have attached a photo of myself as well as my email and phone number so that I can be reached if necessary. I appreciate you listening to my presentation on postpartum hypertension, and I hope that it reminds you that you can create or be a part of plan change too.